What policy or healthcare system gaps must be addressed to improve early diagnosis and management of hypertension?
Yeah, this is the most important thing I always wanted to discuss with community at large and with the healthcare authorities if they listen to me. See, in certain countries like Japan, the content of the what are the ingredients, for example, of fast foods are prominently displayed. This is one of the strategies which the Kenyan government can undertake to reduce the consumption of junk food. Especially crisps are consumed a lot in Kenya, and the crisps, they contain so much of salt, which is the most important and sole contributor of development of hypertension all through the world. Okay, when compared to our earlier generations, we are consuming copious amounts of salt. This is the most important lifestyle change that has led to the epidemic of hypertension, especially in the developed world, now creeping into developing world. Okay, so by displaying the amount of salt that is contained on the fast foods, and by displaying what is the healthy quantity that a person can consume and how much more a given fast food is containing, we can actually reduce the intake of salt. That is the most important thing which the governments can take as a policy decision. Apart from that, people should be taught that exposure to ultraviolet radiation, especially after the dusk, that is after the sunsets, which is leading to lack of sleep in many populations, which leads to a lot of development of stress, and that it leads to the development of hypertension. Especially when I see the kids nowadays, most of them are addicted to cell phones. So this cell phone addiction is leading to lot of stress in life, and stress is the most important triggering factor for development of hypertension. Okay. Apart from all these things, healthy diet should always be taught to young people especially. Okay. Other than this, the development of PCOD, polycystic ovarian disease, is very common in Kenya among the women. In my opinion, this polycystic ovarian disease is also leading to development of obesity and also leading to development of hypertension and diabetes, that is lifestyle related diseases in Kenya. So educating the females early to take care of themselves, when the signs of PCOD are visible to them or they felt them, they seek the medical attention early. That can also lead to reducing the incidence of hypertension in Kenya. And as I told in my previous previous answers, hypertension is the single most leading cause of chronic kidney disease in Kenya. So when awareness talks like this are conducted on a regular basis, people can get to that culture of taking care of themselves, putting the health first, and early detection of lifestyle related diseases like hypertension, and restricting the incidence of chronic kidney disease. Because I see that most of the SHA funds are being used for, most of the funds are used for, if not most significant amount of that are being used for catering the dialysis patients. See, so these things can be avoided and funds can be better utilized and people can become healthy when education programs like these are conducted. So government should take it as a policy initiative to conduct healthcare education programs like by the subject experts on a regular basis, which can lead to better healthcare outcomes of this country as a whole. If you had liked this video, please like, share and subscribe.